This video segment is relating to an interesting finding, incidental finding in the liver. What is your eye interpretation as regards grading of this liver? Can you make out the difference between the echogenicity and brightness of this liver? This is the right lobe of the liver. Okay. And this is the left lobe of the liver. Now if you see that this liver shows normal parenchymal echogenicity, there is no coarseness, no focalian, and the same liver is showing fatty changes. These are all fatty changes. So the echo brightness of this liver or echogenicity of this liver with no coarseness is much higher as compared to that of this liver, this portion of the liver. And note that the vessel margins are so blurred in this part of the liver which is fatty, and the fatty liver has smooth regular outer surface. There is no coarseness. This is the left lobe of the liver in longitudinal section. This is the ligamentum venosum. This is IVC. This is the caudate lobe. This is the extrahepatic portion of the portal vein. This is the extrahepatic portion of the portal vein. This is the left lobe of the liver. लंबा सा लेके सारों बस बाहर कर दे. This is the transverse section of the left lobe of the liver. And this is the left hepatic vein entering the IVC. This is the left hepatic vein entering the IVC and dividing the left lobe of the liver into segment 3 and segment 2. This is the middle hepatic vein which divides the liver into right lobe and the left lobe. This is the left lobe and this will be the right lobe, this inferior portion. Note the diaphragm, the echogenicity of the diaphragm. This is inferior vena cava. Now this part, this superior part of the liver, left lobe of the liver, is giving fatty changes, whereas this part of the liver, which is inferior to the middle hepatic vein, is normal in echogenicity and texture. such livers which contain normal and fatty areas are called geographic liver. This is a geographic liver, in fact, with half of the liver seen fatty and half of the liver seen normal in echogenicity and texture. So most of the right lobe of the liver is normal in echogenicity and texture, whereas the left lobe of the liver shows fatty changes. Now this map-shaped bright area is the liver with fatty changes. This part of the middle part of the liver is the right lobe of the liver with normal parenchymal echogenicity and homogeneous texture. It has diaphragm is normal, the outer surface is smooth, otherwise the angle of the liver is sharp. This is the angle of the liver, it is sharp. Now this is the right kidney, and you will see patches of, you see a patch of fatty liver anterior to the upper soliloquy. This part of the liver shows normal echogenicity and texture, while this part of the liver is showing echogenicity, increased echogenicity with homogeneous texture. This is the left kidney, and this is the area showing fatty parenchymal changes. So this liver is partially fatty and partially normal in echogenicity. This is the lower pole of the right kidney. And transfer section. Lamba sa leke saro kya hai. Again, you will see that now this part of the liver is normal in echogenicity. Compare it with the cortical echogenicity of the kidney. This is normal, and this map-shaped area that you are seeing, this map-shaped area, this is the liver having fatty changes. Okay, so in one liver you are seeing two changes. One is normal in echogenicity and ecotexture. The other is having fatty liver parenchymal changes with homogeneous texture, smooth outer surface. And the area of the liver, now you see, this will be more clear to you. You can see that this half of the liver shows normal parenchymal echogenicity. Segment 6, 7, 5, 6, all are normal in echogenicity and texture, and this lateral portion with segment 4A, 4B, 2, 3, this is the liver with cutoff is seen here, almost somewhere here. So now this liver is fatty liver, this liver is normal in echogenicity. See the sharpness of the vessel, note the blurriness of the vessel. Now the periportal echoes are seen decreased, attenuated. This is the portal vein, this is the gallbladder, and here, because the liver is echogenic in this area and shows fatty changes, the periportal echoes are seen attenuated or decreased. The portion of the liver with that has normal echogenicity. The vessel sharpness, see the vessels are very sharp in outline, and where the fatty patch will be intervening, the outer surface of the liver becomes blurred. So this is a small patch seen. So this type of a liver is called a geographic liver, being partially fatty, partially normal. लंबा सा लेके सारों को this part is normal. See the vessel sharpness, see the vessel edges, and see the vessel edges where the liver is fatty. In this part where the liver is normal, the edges are sharp. Here the edges are blurred. And as you know, that the caudate lobe is always paired, and this is the caudate lobe between ligamentum venosum and IVC. So it is normal in echogenicity, where rest of the left lobe of the liver in longitudinal section is showing fatty changes. So this is basically an ultrasound study of a geographic liver that is partially fatty and partially normal in echogenicity, with homogeneous texture, no focal lesion, no calcification, and the attenuated periportal echoes are because of the fatty liver parenchymal changes. However, otherwise this liver is normal. Compare the echogenicity with the liver, with the pancreas. This is pancreas, this portion. Compare it with the liver. This portion is pancreas, this is splenic vein, superior mesenteric artery, aorta, IVC, superior mesenteric vein, and this is the collapsed bowel. Compare it. लंबा सा लेके सारों compare these two different. This is the pancreas in transverse section, body of the pancreas, and this